So firstly, a big thank you from all of us to our speakers that we're delighted to have join us today, and to everybody who's taking part. I just wanted to give a quick reminder of what we are actually going to be going through. And day one, which is kind of we're focusing on before COVID, who are your client groups? Are they data-based? How many people do you tend to engage with? Outcomes to date, and really a time to celebrate the work underway. Day two is an engagement response to lockdown, and obviously we all know that we're starting to see various challenges coming out of the shielding period for a lot of individuals that we'll all be working with. So we want to focus on what happened next, what are we offering? Obviously a lot of services have gone digital. What has worked and what hasn't, and how are we evaluating our processes and how do we mark its value? And then day three is a much more open forum and discussion, which is going to focus on what stays and what goes in terms of everyone's point of view, future challenges, including really trauma from this COVID-19 year, really, as it's turning into. Issues and rises in mental health and loneliness and isolation and depression. And what is our route out of this? How can we collaborate a little bit like we are today? And how can we connect with different organisations and come up with creative solutions? That will then be followed by a Q&A panel and an open forum. So as Lolly has already said, we'd just like to have all attendees mute themselves and turn their camera off unless they are presenting. Just to remind people that by joining the meeting, they've agreed to us recording and sharing it. There will be a bar that's showing it that when the recording has begun, which Lolly has just outlined. And all questions, please, via the chat box, which Lolly will collate, and then we'll raise at the end of each speaker the most relevant questions to ask during the session. Any unanswered questions, we will follow up with an email, and all the answers will be circulated along with the PowerPoints, the sessions and the survey details. Obviously, Lolly's just gone through how to pin a speaker, but if anybody has any challenges through the conference, if they just put it through in the chat box, we'll try to pick that up for you. Speakers will be in full screen mode automatically, we hope. And they will share their screen to show their PowerPoints and their PDFs, etc. The survey link will be sent around to everybody. And if you'd like to share organisation details and your contact details, then please send them to the community service at cornwallhospice.co.uk email address, and we'll share that again and share all the information, we hope, within a week of the sessions. So I don't think you really want to hear any more from me. We want to hear from our speakers, which is obviously kind of why we're all here today, to hear all of those people start to speak. So I'm going to hand over to Tracey.
Okay, and for once I actually remembered to take my mute button off. Can everybody see me, hear me? All right, now for my next trick, I'm actually going to attempt to put up a slide. Can everybody see the slide? Nod away, thank you. So it's a bit too early really for us to start on reflecting some of the lessons, and in all honesty, I can't remember what on earth we were doing pre-COVID. It's all COVID now, as far as I can see, and will be for some time. But I thought what might be useful is if I talk about some of our organisational experience and what happened, and just say a little bit about the priorities, because what's interesting is that although everything has changed, nothing has changed. So all the priorities that we had before COVID are still our priorities. They've just been sharpened, and things that we were wanting to test and know, we now know. So I'll reflect on some of those, but I just wanted to start with this, which is our 5-month experience, if you like, of the organisation. My apologies if you've already seen some of this. So we started to prepare our COVID response about 6 weeks before lockdown. And we'd already surveyed some of our staff to understand what services needed to stay in the building, what services could be developed from home, which staff were going to be potentially shielding and were most vulnerable. And so where we are now, we never closed our office spaces, any of them. And most of us work a blended day or a blended week. Some of us are in the office and some of us are at home. We circle around those key services that staff determined had to be office-based, which is our helplines, both community helpline and transport helpline. So the teams felt that there was added value about being in the office at that time to be able to share experiences. And so effectively, we made that our priority and we circled around it. About 70% of our volunteers, we have around 350, and about 10% of our staff, we have about 130, needed to step back and work from home, either because they had underlying conditions, they needed to shield, or they went into voluntary isolation. So the rest of our teams, we deployed directly to the front line at the beginning of COVID to be able to respond to need. We're really blessed in the sense that we've got a clinical lead in the organisation, so she was redeployed to develop mental wellbeing services for our staff and volunteers, particularly those that were shielding or isolating. We deployed all of our community coaches, our outreach teams, to support the 3,000 plus individuals who we've already got on our database. So those are individuals who we've supported, who've given us their consent to hold their information, and that we provided ongoing support for. So we worked with partners, and one of the benefits, I think, and one of the opportunities there has been through this whole period is the development of our partnerships and our ability to pull it together across a whole range of different organisations across the county, local, but also national. One of the blessings that we had with our commissioners were very supportive and helped us step down some of the performance management work that we've been doing to be able to direct capacity to our front line. And one of the things that I wish we could keep, but I suspect that we can't, was the stepping down of regulation. So we have winter pressures funding from NHS England, which ended in March. And by the middle of March, we had a thumbs up emoji to say that we could be funded through to the end of September. Unfortunately, now we come to the end of September, I've got a 62-page form to fill in for the rest of the funding. But at that time, it was great to see regulation being stepping down. First few days, we had about 800 volunteer calls, people who wanted to help, and that really did cause us some considerable problem, partly because it completely clogged up our lines so that people couldn't get through to us, but also we had no capacity to be able to manage 800 new volunteers. What we did do was signpost those to their local community so that we could link people and potential volunteers to their most local community. And we set up the COVID-19 space on our Cornwall link, which has now had about 40,000 visitors to that site. We paused our day services originally in the first couple of weeks, and those teams turned overnight into visiting teams, developing Meals on Wheels support. We're now back to providing those day services within bubbles, both outside in open spaces, but also in the centres within guidelines. So like many charities, we also rely on income for that is non-commissioned income, so fundraising and charged for services. And over the 6 months, we will have lost in the region of about £250,000. And I guess that's quite good compared to a lot of charities and where they find themselves, but we've had to make redundancies. We've had to talk to staff who voluntarily taken reduced hours, and we've had to put in an awful lot of grant donations. So the infographic that you can see there, it's on our website if you want to have a look at it. There are various links to documents that you can have a look at as you go through. What I would say is, in terms of how the staff have adapted, on the infographic, you can have a look at some of our storytelling. Storytelling is really key to our organisation. It's really important to us, and we ask staff and volunteers and clients to talk about their storytelling. This one is from Rebecca, who actually was our gardening lead at the beginning of COVID, and then quickly shifted to deliver medication shopping and support services to people in their community. We've encouraged our teams to tell their stories and their experiences and log them where we've got consent onto the Cornwall link. And I think you can really see the level of resilience, adaptability and integration across all of our teams, and that's really paid off. As an organisation, we've spent an awful lot of time working on that. You cannot lead something as challenging and as uncertain as a pandemic from the top of the organisation. So my personal reflection would be you have to trust the people in your organisation to go and do what's best. And, you know, it's humbling actually when you look back and you realise that that kind of devolved leadership has really come to life during this process. We've just got a couple more slides. So this one is about transport. We had a big transport team. We still have a big transport team, but 70% of those volunteers that do our community transport had to step back almost overnight from developing and driving, mainly because they are of their age or their underlying conditions, which meant we had to reshape our transport really quickly and focus predominantly on all of our efforts going into getting people to their renal and oncology appointments. And that meant staff getting in their cars under guidelines with full PPE and making that work. So, you know, for the first 2 weeks, that's pretty much all I did, was drive people around to their renal appointments. That's pretty much all that many of us did. We've got 6 electric vehicles. You can see one here on the screen. They came into their own after some debate about whether we were going to even have these electric vehicles. Now we want more. So there is definitely a 2-metre distance between front and back, so it means that we can carry people really safely in them. They're cheaper, it's low carbon emissions, but you can also, anybody can take them out. It's a membership scheme. So we gave those cars effectively to local communities to be able to run their own community services. So this is what I mean about those issues that we had before COVID are still our issues now. These were our priorities before COVID. They're our priorities with bells on. And I won't run through them all, but I will just talk about a couple because they're really important. So we all know connectivity is a key priority, and now I think we've all felt it. So we've all had aspects of what isolation and social isolation means to us, and we've experienced it in some way. And one of the key things for me, for the organisation, is about digital connectivity and broadband as a human right. What is absolutely clear is if you're not digitally connected, for whatever reason that might be, you are disconnected from the range of choices, information, support, activity that other people can access. Even basic things like being able to access your own cash and spend your own money became a real challenge for people. And that's one of the key areas that we'll need to look at as we go forward. Inclusivity, engaging all aspects of community. We've been working quite strongly with Black Voices Cornwall and LGBTQ+ communities to identify individuals who might not necessarily have come to us for support or might not necessarily have got support from anywhere else, to be able to engage them and look at those who might be most marginalised. It's definitely exacerbated this period issues of cognition and reduced activity. As we started to go back into people's homes, probably about 2 months ago now, we have made more safeguarding alerts in the last 5 weeks, I would say, than we have in the last 5 years. Self-neglect, issues of physical activity, limited mobility around the home, support for carers, all issues which we knew before, majorly exacerbated during this period. And finally, just that issue around continuing to learn from all of this. So community resilience and sustainability, sharing our values is really strong. It's a strong ethos in our organisation, but we've really had to step back the regulation, increase the ability of people to be able to respond quickly without going through reams of decision making, to just do the right thing at the right place. And I just shared this with you, which is our link to the Cornwall link, and encourage you, if you've got time, to be able to go on to the Cornwall link. It has been invaluable for us as a way of being able to connect people to what's going on in their community, to be able to support people, to be able to access the services that they need, to be able to pinpoint volunteers to their most local connection. And, you know, above all, we want to continue that throughout COVID, throughout this next period. All of those amazing community activists that came forward at the beginning of this time, we want to be able to support and encourage those to continue. So I would just encourage you to go on the Cornwall link. We've logged everything that we can, but if you've got services that are not on there, log them on yourself so that people can find you. And then through our helplines and support services, we can connect people to the services that you have. And I'll stop there.
Thanks so much, Tracey, for that. I mean, gosh, what an amazing overview of all the work that you and your team have taken through the COVID period. And I think some of your challenges that you've raised are absolutely kind of what is indicative of what is coming out. And I guess one of the questions, unless anyone else has got a question at the moment for Tracey, one of my questions would be about how you kind of start to see some of the programmes of work to enhance digital reach within the county, how perhaps issues with cognition and safeguarding as a system and all of us working together can be taken forward, and perhaps also really just how we start to address some of these gaps, because as you say, there's a challenging background with funding and everything that's happening around that, which is again for the sector a key issue. But how do you kind of, your kind of thoughts really on how you see us collaborating around that?
So the Voluntary Sector Forum and Helen, and I don't know whether she's on the call today or she's on leave. So that was quite pivotal at the beginning of COVID to connect us to lots of other voluntary sector organisations to be able to work across all sorts of boundaries. So that has been really, really helpful in terms of digital. So working with Dawn on at Inclusion Cornwall, we've managed to get hold of funding and a number of iPads that we're making Wi-Fi enabled to be able to create opportunities for people to connect. So one of the things that we know is that individuals are really nervous about coming out of their homes and reconnecting socially, physically with people. And so we're trying to connect them to the group that they used to go to, but virtually. So training up volunteers, making it as easy as possible with kind of Wi-Fi enabled mobile iPads to be able to connect them to others that they might have had lunch with, that they might have gone to a memory cafe with or whatever, as an easy way of connecting people back to their own communities. We're working with iCare, iMove and Public Health Cornwall on false prevention programmes. So how can we connect people to false prevention and be able to support them in that way? We've shifted all of our diabetes prevention to Zoom and supported people to get online to be able to connect to us. But it's a challenge, isn't it? You know, it's a massive challenge, particularly for the older generation in Cornwall, where we have so many people who are not connected to digital in a time when digital is sometimes our only connection. So I'm not suggesting that we've got any major solutions to it, but it feels like that issue of creating a real campaign around digital connectivity is really crucial for all of us going forward.
Yeah, absolutely. I completely agree. So I'm just conscious of keeping an eye on time, but I guess one question just on that from Tim Burns is digital inclusion is obviously a national issue now. And are you able to feed that back up more nationally in terms of what kind of support could be given to Cornwall?
So in part, yes, although I would welcome any conversation with other organisations that have better national connections than we do. So we've been able to raise those issues through our Winter Pressures network, which is a group of, so it's Red Cross, us and WI, WRVS that are connected nationally. And we've been able to raise it through the Age UK network because it's something that's felt across the country, not just in Cornwall. But I'm not aware of any major themes of funding coming through to really address that broadband as a human right issue. So I would welcome any thoughts that partners and colleagues have on how we might collectively do that in a rural county.
Great, thank you. And just one more question, then we'll move on. Can people still apply for the laptops and the notepads?
Yeah, so we've got them. We're just going through the process now of making sure as many of them are enabled as possible, and then we'll be sorting out the kind of lending library type approach. But if you are aware of people that would benefit from it, contact our helpline, and I'll put the number in the chat box in a minute so you know where that is, or our digital lead, and we'll help you do that.
Fantastic. Thank you so much for your time today, Tracey. It's been really interesting to see all of that. I mean, and absolutely hats off to the organisation for the amount of work that's kind of been taking place. And I think I completely agree with the storytelling. I think that's the best way to absolutely share people's experience and to bring things to life. So thank you for sharing all of that with us. Really appreciate it.
You're welcome.
And Louise Knox from Pentree, throw it over to you.
So Louise isn't able to join us today, sadly, so Anna has agreed to step in.
Yep, my fault. Sorry, Lolly. Anna?
That's why we're
Okay, over to you.
Yes, hello everyone. I had some trouble earlier trying to share my PowerPoint, so I'll try it once more, but I've also just sent it via email to Lolly and Kelly. I'm not sure if you would otherwise be able to open it and share it whilst I talk over it. Not sure if that's a possibility. It might not work, but I'll try. But I don't think there's anything happening here, so I open my tray. Are you able to see my screen? Are you able to see it?
Not at the moment. I'll try and bring it up on my computer for you as well.
I've got it here.
Okay.
If that's any help to anybody.
Yeah, great. Thanks, Lolly.
Just one sec. Do you want to introduce yourself, Anna? Because obviously.
Yeah, that's absolutely fine. So yeah, I'm Anna Heutte. I'm a GP with special interest in lifestyle medicine. And I'm also a health coach and a yoga teacher, which kind of led to me volunteering as a regional director for Cornwall for the British Society of Lifestyle Medicine. And yeah, I'm really excited to have the opportunity today to just share a bit about our work and what we've been up to since Kernow BSLM was founded last year. So if, oh, perfect, you've got the PowerPoint up there, have you? Brilliant. Yeah, if you go to the next slide for me. Keep clicking. Sorry, I think it might have a few clicks in it. Yeah, so perhaps if you start with, what is lifestyle medicine, and another click, one more hit. So in a nutshell, it really is about focusing on enabling a healthy lifestyle to prevent and treat disease, which I'm sure you all agree is really challenging in our modern life those days. Keep on clicking if you don't mind. Yeah, so I'm really hopeful that, sorry, back to the last one, just a picture there. So kind of comparing lifestyle medicine to conventional medicine. I often found working as a GP, we spent a lot of time kind of mopping up, spilled water on the floor, whilst actually if you could go to the tap and really kind of go to the source and get things right from the beginning, I think we would be winning. So I think that's what lifestyle medicine for me is about. Thank you. Next slide. Keep clicking for me, Lolly. That's it. So if you think about what are the kind of pillars or foundations of our health, and the next slide, we're giving it all away in one go here, so I appreciate we don't have much time. And I'm sure you are already aware of, the importance of sleep, being physically active, a healthy diet, and again, lifestyle medicine focuses on a whole food, mainly but not exclusively plant-based diet. Stress management and emotional wellness is really important. Smoking cessation and avoiding risky substances, including alcohol and, certain drugs certainly count into it. And Tracey already mentioned kind of the importance of social connection and purpose. So that's another real key pillar of our health. Thank you. And the next slide. So, you might have wondered, okay, I've heard about all those, and what makes lifestyle medicine so special is that it's informed by scientific evidence. So there's a lot of exciting studies emerging most days now that tell us about which of those lifestyle changes do make a real difference. And it really is about kind of empowering every member of our society to take control of their own health and well-being journey. Next slide, please. Okay. So lifestyle medicine combines kind of those lifestyle changes I just mentioned that have been proven to work with tested intervention to support people in their behavior change, because we all know it's not as easy as stop eating chocolate, move more. It just, doesn't cut it. So it really is about kind of person-centered care, support planning, social prescribing, group consultations, things like health coaching, motivation interviewing, and other things like that are part of it. Thank you. The next slide. And we realized very early on that this needs a team approach, because no one discipline or one profession alone can really meet our health needs. Thank you. Next one. So that's why we decided to kind of form this local group of the British Society of Lifestyle Medicine, so the Kernow BSLM. And we actually have another event coming up in December, which we unfortunately had to move for March time, because we had a schedule just before the official lockdown started. And you actually can see it on there, but we certainly have quite an exciting mix of presenters or speakers. And within the group, we already have quite a lot of special interest groups. So as you can see on the left bottom there, we got some people who are very interested in MSK, mental health and trauma, chronic pain, and the list goes on. So there's a good chance that for whatever area you're interested in, there is already some people here in Cornwall who are very interested in taking this forward in a healthy way. And the next slide, please. That's it. So we decided it would be worthwhile kind of having this local group just to kind of share resources, inspiration, the evidence, as I mentioned, and some support in order to really demedicalize those chronic conditions. And again, as I mentioned before, it's about enabling those individuals to feel in control of their own health and well-being. So we already had quite a few of those education events for healthcare professionals. We're hoping to also offer some for kind of the general public around those kind of pillars of lifestyle medicine, of health we just very briefly touched upon. Thank you. The next slide. So a really good website to start to have a look at is one of the BSLM. So you find that just following the www.bslm.co.uk link. You might also want to look up #OneChange, which is just a very easy way of starting to make some changes, just one change at a time, kind of towards kind of a healthier lifestyle. And it's really well explained. I won't go into it now. But we certainly are interested in having more people involved kind of in our Kernow BSLM group. And we currently have about 150 professionals, and it's a really, colourful, brilliant mix. So we do have quite a few doctors in there, nurses, but it's all about also getting the social and, other health professionals involved. So we got some social prescribers on there, and, really colourful mix from personal trainers over yoga teachers. So there's a really good chance that whichever field you're working in, you would be able to join us as well, as we're currently not accepting just general public memberships. But on the website, again, it is detailed who would qualify for full and associate BSLM membership. And if you find yourself on that long list, please just get in touch and join us. We currently got an email distribution list and a WhatsApp group going, and several special interest groups who have their own WhatsApp setup connections. You don't have to join the official BSLM in order to become a member of the Kernow BSLM, though it is a really great society to be involved with. But you could just have a look if you find yourself on that list. If you have any queries, if you're not quite sure, please do get in touch, because if you're working in health politics or just in the social sector, there's a really good chance that we'd be more than happy to have you on board as well. The website, just to warn you, is currently under some redesign, so I think some of the information might not be on there at the moment. So if you can't find what you're looking for, again, just send me an email. And yeah, just another quick note, the BSLM has the annual conference as well, which will start tomorrow. So if you're really excited about this, you could have a look into that and sign up last minute. And just another note about my email, please do email me. I'm about to go on maternity leave, so it might take a while to get back to you. Though I'll keep an eye on my emails whilst on maternity leave. Okay, yeah, any questions? Yeah, if you click through that one, it's got my email address on there again. And yeah, thanks for listening.
Thanks, Anna. And as a member of the group, I have to say, turning up in Perranporth for an evening curry and a really informal conversation with lots of other people was inspiring. Sometimes, and I guess this is what COVID-19 has taught us, that less formal can sometimes be better, and having the opportunity to just chat and have like-minded individuals have the opportunity to have a conversation, I think is incredibly powerful. And also the WhatsApp group and the way that that works in terms of the special interest groups is also really interesting to see all the dialogue. I guess one of my questions, I can see we have another question from Alice, is just to start us off, is what do you kind of see some of the opportunities maybe to work with some of the issues Tracey has already highlighted, and how we can start to join up the dots really with the work that's underway with BSLM, but all of the other great work that's underway, so that we kind of have a real overview and way that people can engage across Cornwall?
I think that's a really good question, and I think that was one of the benefits we found quite early on, just having that connection kind of within that WhatsApp group, which seems to be really quick to respond. So if there is anything happening, people would just mention it to the group, and then whoever has something to contribute seems to be quite quick to say, yeah, I could be interested, and then they perhaps kind of meet up in smaller groups, because I guess in a group of 150 you really need to make sure that the right people are connected and work efficiently in a team. But yeah, I think it just is a matter of like getting people from all the different fields together, isn't it, in that group, and having that conversation, which is going to be.
I think so. Something that's very powerful is breaking down the barriers between professions, and so the group is a complete mix of everybody, which otherwise you may have to work through kind of quite a lot of bureaucracy to get to quite a lot of those people. So seeing that dynamic approach, which again is what has happened in COVID-19, is something I really think we hopefully can learn from and start to develop more of. So I can already see that we've got people saying that they would like to get in touch, and to somebody that's just set up, Alice that's just set up Nature Connects, which sounds fascinating as well. So great. It was also spoken about at the Patient Participation Group conference that was run by the Citizens Advisory Panel in November last year. So again, how we can continue to join up these dots, raise awareness, I think, and share best practice is great. So thank you so much for stepping in at the last minute to do that for us. And if there's no other questions for Anna, we'll move over to Fiona Franklin from Re-engage.
There is one question.
Yeah.
Jane Howard, Artswell, has just asked, she's struggling to connect to the website. Are you able to speak, Jane? I think.
Yeah, sure. Yeah, I just clicked on the bslm.co.uk link, and it just said can't connect, and try again and everything else, and it won't connect. So I don't know whether that's a temporary issue, or whether that addresses something with that.
Yeah, sorry, that might have yeah, no, I think I got a typo in there. I think it's .org.uk, as John just pointed out there as well. And .co.uk. That will hopefully work, that link.
That'll do it. And I imagine also, Anna, there is a Facebook page as well, is there not? So that's another way of contacting.
There is a BSLM Facebook page for sure. And yeah, I mean, we're really excited to have some of the expert patients on board already. And as I said, we're hoping to open it up more and more. But yeah, it's just brilliant to have both of you on board as well. So yeah, it's really exciting, and looking forward to work together again. And thanks again for having me today.
Thank you.
So over to Fiona Franklin from Re-engage.
Hello everyone, lovely to see some faces. Nikki, it's been a while since I've seen you, but good to see you. For those of you who know about our charity, we used to be called Contact the Elderly. We're now into our 55th year as a charity, set up in 1965. And in Cornwall, we've had a checkered history. We do have our core service, which is running social activity Sunday afternoon tea parties, and they have been running for a number of years in a number of locations, but not as many as we'd like. I was moved into post a couple of years ago, and so have been developing Cornwall and raising the profile of the charity. Like every other service where it was face-to-face contact, back in March we had to suspend our tea parties, but we ensured as a charity personally contacting all of the group coordinators, so the volunteer coordinators of groups across the country, including Cornwall, to ensure that they were contacting the guests, the older people in their groups. For our tea parties, the entry age was 75 and above, although we took our referrals on a case-by-case basis. So if there were particular circumstances that we would accept people younger than that, and they could. The main criteria was that they lived alone, and for us it was about reducing, and has always been about reducing, loneliness and social isolation. As I've explained, the same as everybody else that had a face-to-face service, in March we had to suspend that, and having contacted all of our existing groups, of which we have 900 across the country and 19,000 volunteers, 8,000 older people that receive a service from us. Having ensured they were all being contacted, we then looked into developing a new service. That's called Call Companions, and I'm going to have an attempt myself at sharing one of my screens and see if I can get you to have a little look at the thing that I've got there. Will it share? Currently it's not sharing, so we'll go for that one and see if we can get that one to share. Hopefully you can see. Hopefully you can see that one. I'm not exactly sure what you're seeing right now. It sometimes takes a while for my computer to warm up.
That's working, Fiona.
It is wonderful. So this is our main website, and as I say, very similar to Age UK. We had a situation where it was the staff members, frontline staff members like myself, a development officer in a particular region, who were tasked with setting up the new Call Companion service. And that was great because we genuinely knew the challenges that the older people that we supported faced, and therefore we were able to create a service that was tailored to them. It means that it's now become a nationwide service. It will be a permanent service for the charity. We're also encouraging people to refer into us or to talk and recommend us to other people, because once we have the details of an older person, as we're able to start up our tea parties again, they're already registered with us, and hopefully then we can offer them that service as well. It is a telephone befriending service. It means that anybody in any place across Cornwall can access our service. We had a fantastic response. Like many other charities, we faced a funding crisis, but were successful, I'm proud to say, with PG Tips, and they gave us some funding to promote the new service, and were successful in recruiting 2,500 new volunteers to provide that telephone befriending service. It's now been running since the end of May, and we have over 700 older people across the country that are being called. At the moment, we only have 7 in Cornwall, but we have a lot that have been referred recently, and I'm hoping those numbers are going to be up sort of certainly into the 50s, if not the hundreds, by the end of the year. So we have changed the age restriction for our Call Companion service. So the main criteria is loneliness and social isolation, and we are accepting people as young as 50 into our service. We know that people are very, very lonely, and certainly are are lonely long before they get to the age of 75. What you see on my screen is from our website, and this particular lady is just one example of many of the people who have benefited from our service. And I've been very privileged. I sit on the team alongside some of my staff colleagues who I was instrumental in actually setting up this service of Call Companions and making those frontline phone calls to potential beneficiaries. For some people, they hadn't spoken to anybody for maybe 10, 12 weeks in some cases, just horrendous situations. I have a gentleman that I spoke to back at the beginning of April down in Falmouth, and he told me that he had no living family. He had Tesco's delivering his food once a week, and that was the only contact he had with the outside world. He hadn't been outside his house for a month. He was terrified to go out, and he was absolutely delighted to be receiving the calls from us. There are other members who I've spoken to in Cornwall with very similar stories. We all know the situation in Cornwall. It comes as no surprise to any of you to know that there are many, many people that perhaps have retired to Cornwall only then to find themselves incredibly isolated in parts of Cornwall that aren't easily accessible. And once you lose access to independent transport, becomes even more difficult to maintain contact with other people. So for Call Companions at the moment, it's a service, it's a weekly based service that will provide a telephone call. We say about half an hour, but to be honest, it can be for a lot longer than that. And again, it's entirely up to the volunteer and the beneficiary as to how long they might want that phone call for and for how often. So some people are receiving calls twice a week, some are just having it once every 2 weeks. It's really up to the individuals. We have the selection or the matching process through an application form which tells us a little about their hobbies and interests. That's both for the volunteer and the beneficiary. We then phone each one of the beneficiaries individually. As I say, I've been privileged to speak to many of them, and just to get an idea of their hobbies, interests, past life experiences as a conversation starter to help match them with a volunteer with similar interests. And it's been really successful. I don't think I need to tell any of you the difference it can make, just one simple phone call to people. But for us, certainly as a charity, it has gone a long way to a lot of staff members to know of the people that we've been able to help. And I, as I say, have been privileged to speak to beneficiaries from Penzance, Falmouth, and all the way up to the Shetland Islands in Heutte, to one particular lady up there. So we really have covered the whole of the country. I think the other thing to know with our charity, as I say, we are now starting to put together a plan to relaunch our tea parties. It was our core service. Nikki is aware of our tea parties. They're monthly Sunday afternoon gatherings, and they're purely run by volunteers, local volunteers, a driver with collector, an older person, take them to the tea party, couple of hours in somebody's home, and then drive them home again. I've already taken down the note for Age UK and their accessibility of maybe keeping those links going. So if somebody has registered with us through Call Companions, we'll have their details and be able to offer them hopefully that service of tea parties when they restart. I'm afraid I can't give you a date to that yet. Like many other services, we're just waiting until government guidelines give us the green light to be able to run them safely. I know we have some very creative groups that are already running tea parties in some form or another. They're going to garden centres and maintaining social distancing. Quite how they're doing it, I haven't quite, I'm a bit worried to know exactly how they're doing it. Certainly, hopefully not taking people in their cars. But it's testament to the many volunteers that we support, that their commitment and their passion for what they do with us as a charity. I'm also a volunteer and have been for 10 years for the charity. So I know the difference that those social gatherings have made to our to our guests, well, to all of us actually. I benefit just as much as anybody else. It also has to be said, I'll just keep scrolling down there, so I'm sorry I can't get to see it all. Also has to be said that for me, talking to my guests through the last 4 months, which I've been doing on a regular basis, it's really interesting talking to them and just hearing how they've managed this lockdown period. I know it's been mentioned already today about the mental health issues that people have been experiencing. The resilience of many older people has been phenomenal, but it's also been incredibly challenging for many. And to know that they still are able to contact us, that we still have that contact with them, and have gone above and beyond. So tea party gift boxes have been going around on a monthly basis to my group, and that's been happening in other places. So as a charity, we hope and we will commit to this service being an ongoing service for as long as people want it, and to continue having this service alongside our tea party service as and when that restarts. And that's about me for the presentation. So if anybody has any questions.
Thanks, Fiona. That's really, really helpful. And I know when we had a conversation about setting up tea parties when you first came down to set them up in Cornwall, and I think it's such a valuable service at the weekend when a lot of people feel more isolated, because core services tend to be Monday to Friday. So weekends tends to leave people feeling more vulnerable and more isolated. So and also about the importance of I suppose getting in touch with those movers and shakers in local communities that are really going to help get these networks off the ground. I just wanted to kind of, I think the move as well to people as young as 50 is absolutely fantastic. I just wondered about, really from you and from Tracey, about the importance of perhaps how we can engage with domestic care agencies and care providers to actually reach some of these people who are very isolated and on their own, and how we can actually get better support, or your thoughts on that, from those people who are on the front line on a day-to-day basis to help them engage with these with organisations like yours. Because for me at the moment, listening and observing things, obviously we've got social prescribers linked to GP surgeries, but it would be great to have some thoughts about how we can engage, or if there are projects on the go already that are engaging with care agencies.
Certainly from my experience, I've had some success with certain care agencies that will refer and are keen to use our service, but for others it's not. And I think it's just I find it very individual. Almost at times a wariness from some care providers as to what it is that we're trying to provide, and it is run purely by volunteers. So we're not stepping on anybody's toes, and we're certainly not taking their service away from them. It's just about added support. As we know, often they are really strapped for time when they are going into people's homes, and that's where the difference is. And that's what I always try and put across to people is, or to those care agencies, is we have volunteers that have time, and it's the time that the beneficiaries really need, the chat, the talk that's so beneficial to them. So it's a challenge, I won't deny. Wellbeing fairs are often a place where I have met with care providers, and then if I start to build up that relationship, often, as you know, Kelly, Nikki, it's that face-to-face contact that makes all the difference, is breaking down those barriers. So that would be my thing. Tracey, you've got your hand up there.
Yeah, I was just going to respond to that, Nikki, a similar point to Fiona, really. I think to some extent it very much is relationship based, and it tends to be very much locality based as well. So where we can work within an area, either around an individual or around a individual strategy around a community, we tend to be able to build up those pathways, and that's not just with dom care agencies or care homes, but actually clinical teams as well. Yeah. It works better. Where we are already providing a support for an individual, the relationship tends to be really good. So this morning, for example, we spoke to a care agency after going in to provide domestic support somebody who we felt was declining in cognition. We spoke to their care agency who'd felt something similar, and then collectively we worked through with the individual what we might do about that, and that works really well. So I think it is those community-based relationships that focus around circling an individual where we can create those pathways. I don't think that's not particularly easy. It's much better to write a protocol and then just hope everybody works to it, but that's not what happens generally. We have to get much better at developing those really individual relationships that focus on providing a person-centered support.
Yeah, just a kind of another quick follow-up to that. What do you think the opportunities might be to incorporate some of this kind of knowledge base of the services are out there in training, given how many carers are continuously being recruited within the care agency market, so that we could actually raise awareness? Do you think there's opportunities for us to do that?
There's probably more opportunities now than there ever has been, aren't there? Because it's virtual, mostly it's virtual. So we're still doing face-to-face inductions for many of our new staff and our new carers. But actually connecting people to a half an hour update that you're doing, once a month and people can connect to is probably a really good way forward. And it's quite simple. It's not very resource intensive, but it allows people the ability to be able to speak and create opportunities for engagement rather than just sending around a leaflet, whether it be digital or actual. And that's probably the best way to create those relationships. And if we can do that in a locational setting or around a theme or a set of themes, I think then people can see it in the image of their own role and see where the value is of connecting to those other teams and organisations.
Yeah, great. Thank you, Tracey. Really appreciate that. And Fiona, there is also a couple of just questions, points there. One is about electronic leaflets and posters that could be distributed through interagency meetings. And the other just around Cornwall Camels renovating a space to help socially isolated older people. And just two, whether or not there is something that you could send out to connect.
Absolutely. There's a lot of literature that I've started to share with Lolly, and I'll make sure that she has that so we can share it out. JPEG versions are very good as a leaflet, so you can upload those to social media platforms such as Facebook, as well as then the leaflets that I've got like this. The other thing is I know that a lot of organisations are now starting to make face-to-face visits again, and I have sitting on my shelf a stock of leaflets that I can share and I can get distributed into Cornwall if that would help raise awareness. Just wanted to come back to the point as well about engaging with care support services. One of the issues that I found in the past was that their protocols, they weren't able to promote one charity over another, so they weren't able to share leaflets. Now, one of the real positives that have come out of COVID is that this explosion of us all having meetings virtually through Zoom. And so what I've been doing a lot of work over the last couple of months is literally having meetings like this with the frontline care support staff, telling them about our service so that they then have a greater understanding, and they can then, without actually having a leaflet, they're not promoting us over anybody else, but they have a greater awareness and can then talk to that person about that, and can actually work it into the conversation. Particularly for a lot of care organisations and housing associations, they were making telephone calls to their service providers through COVID, but as they've gone back to their full-time positions, they haven't been able to continue that. So we've been picking up a lot of that support that they were providing, and that's certainly something that I'm seeing happening down in Cornwall as well. So that's one of the positives of these meetings that we now have virtually, is a way of being able to give training to these to care companies, housing associations, and any other large support services of people who are isolated and need support.
Great. Thank you so much, Fiona. That was a really great overview of all the work underway, and thank you for the presentation. And as you said, we'll share all of the information around following the event.
Absolutely. Thank you.
Thank you. So now we're going to move on to Reuben Jenkins from Carers Break. Reuben, over to you.
Okay, hi guys, can you hear me all right? Yeah, all good. Okay, firstly, thank you very much for the opportunity to be part of this event. Never ceases to amaze me what phenomenal work is going on in Cornwall and around the county. What, you know, there's always bad news on the television, but it's fantastic to see the great work that's being done at the moment. Tracey Roose said something that I found quite poignant at the start. She said that everything's changed, but nothing has changed. And that really, from Carers Break point of view, and I'll go into what we do in a minute, was kind of the cornerstone really for us. We had to think, despite all of the stuff going on around us, we had to be thinking about continuity of care. How are we going to keep things as they were? How are we going to continually improve what we were doing and maintain the level of support and care that was being provided to people on an ongoing basis, despite global changes of an enormous magnitude? And that's been our challenge, really. There have been significant changes in lots of different areas, but I think what I felt I'd like to do is to kind of just recap on what we currently do, because I've always found that you can be in contact with organisations for lots of years and you go on thinking that you know what they do. But the reality is that organisations change and they do different things, they diversify. And Age UK has been a phenomenal example of that really today in all of the changes they've taken on board during this current challenge. Now I'm going to try and get can you see that on your screens? Can you see that, everyone?
Yeah, we've got that.
Okay. Right, okay, so Carers Break, we look at, there's a before COVID picture of Carers Break. And that's what we looked like, it seems, just a few months ago. We look after people of aged 18 to 100 plus. We've had clients of considerably more years than 100 in some cases. And we cover companionship to end-of-life care. Our entry-level care is looking after someone, coming alongside someone who needs to be reintegrated back into the community after suffering perhaps mental health issues or social issues, and going right through every level of care, right up to end-of-life care. The question or the brief we were given is, are they data-based? Yes. We have a refined database system, and that's part of what we do as a social enterprise. We reinvest a terrific amount of resources into our systems and practices. So we've got a very, very smart system that's cloud-based. It's very much a digital program that the staff on the ground have access to. The office staff, either working from home or from the office, can tap into. That covers everything from care planning to staff rotas, staff records, client records, maps, all sorts of information. So we have a very refined database system of everybody that we've previously looked after and currently look after. We respond to referrals from adult social care, the KCCG, privately referred or private direct approaches through our website and different initiatives, and also private corporate approaches. So we could have referrals from other organisations. I'll give you an example. We've been referred to directly by the Freemasons in the past, where they have a support fund for some of their members who need the kind of care that we can provide. Number crunching, that's not my expertise, I'll be honest with you, but we've been going about 7 years now, and we currently support we employ about 45 support workers, and we have 3 office coordinators. On any one day of the week, we'll be looking after about 30 clients. Now, you might think that's a high turnover, but bearing in mind, we look after a lot of people who are end of life or are approaching end of life. Of course, there's a high turnover of clients for us. Yet we do have long-term clients And actually during COVID-19, we've probably seen more of our long-term clients pass away than we would do in the same kind of length of time at any other time that we've been running. So that's quite significant. We provide night support. We do day hours, minimum of 2 hours. One thing that's changed for us, although we set our stall out very early on when we started up as a social enterprise, that we would do a minimum of 2 hours care and nothing less, we have compromised that in order to support the wider system during the last 6 months, and have provided also some shorter timescale visits where necessary to try and relieve the pressure in the system. We cover the county 24 hours a day, 7 days a week, 365 days and nights a year. There is no break in the service that we provide. Outcomes to date, we've provided about 250,000 care hours. And we're quite proud of that, considering that when we started up, we were told by a lot of people that we would never last more than 6 months. We seem to have done rather well, really, despite their prophecies. Hang on, I need to go back one. Last screen, sorry. Okay, so over 1,000 families to date have been enabled to stay at home whilst they're receiving some pretty complex and critical care at home. At one point during an 18-month period, we were privileged to provide an out-of-hours pilot, reducing hospital admissions out of hours, which was valued by the out-of-hours GP team at around 30,000 a month for 18 months. Some months greater, some months less. But during the last 7 years, over 150 people employed and trained during that time. What are we celebrating? Well, pursuit of excellence. Our whole purpose is to do things better. We felt when we started that looking at the care at home situation, things could be done better, and hopefully we've been part of improving those outcomes. Increased collaborations is another one. We're always looking to set up meaningful collaborations and partnerships with organisations where we can complement each other, where we can inter-refer our clients. I've already heard some information today, this afternoon, where I can think of clients who would undoubtedly benefit from knowing about what's available to them that we didn't know about before. Having influence, being able to speak on a forum like this is critical for us, because we feel that it's important to be able to influence an improvement in what goes on in the care at home market as such, or in that arena, and having an impact. We're not here just to tick boxes, but actually our goal and our dream from day one was always to have an impact that would change people's lives for a small time, for the time that we were with them, but for the better, making life better by a little bit at a time. We also do that with our staff, improving terms and conditions. As a social enterprise, we're looking to constantly add value in what we do with our clients, but also through our annual social value gifting program, where we will choose a charity or an outreach within the county that we can support, that will benefit lots and lots of people. Last year it was the MS Centre at Heutte, which was the beneficiary of that program. We're constantly looking at how we can be more flexible to our client groups and more flexible working with work. Summing it up, really, our strapline was always time to care, giving our staff time to care, giving the people that we look after the time to be cared for, which was critical. But something that we have come to understand is people don't care how much you know until they know how much you care. I've also added a few, let me just end the show there, a few notes really from what's been said so far. Changes for us have involved things like recruitment. There are out there loads of volunteers who could also be employees. There are no stereotypes anymore. For a long time, when we started up, we thought that there was a typical stereotype of a community carer, someone who went into someone else's home to look after them. But we've taken on people who are doing law degrees, people who are working on super yachts in the Mediterranean, people who are coming to Cornwall to start businesses of their own, but lockdown changed all of their plans, and we took on a lot of quality people who were also volunteering elsewhere. So we've had to think outside the box in our recruitment. We've had to think outside the box in terms of staff being able to do things more flexibly, giving them the time to work from home, giving them the resources to work from home, giving them that choice. Supporting worker well-being has become an important aspect. We spend all of our time thinking about the people we go to look after, whilst there are 40 odd people in our employ who need looking after sometimes as well. And their mental health and well-being, because of the nature of what they do, has to be upheld. And where cracks were appearing before, what we found in the last 6 months is that some of those gaps have become gaping chasms, and there has to be solutions found very quickly. Carer breakdown, and I'll finish with this. Carer breakdown is a massive issue in the care at home sector. And it's the reason we often get calls to look after people's carer breakdown. But that situation has been accelerated at an incredible rate, where lots and lots more people now are realizing they can't cope because of the situation with their own mental and physical health. That's what we do. That's what we're about. And if anybody's got any questions, I'll be more than happy to answer them.
Thanks so much, Reuben, for that. That was fantastic to see, and really interesting points you kind of raised, particularly around employment. A couple of quick questions from other people. So Lolly's asked, do you cover the far west of the county, as your map doesn't show that? And also from Rebecca, what about the Roseland Peninsula?
Okay. Yes, we cover the whole of the county. We've gone into Lifton, we've gone into Plymouth, just across the bridge. We've worked as far as Land's End. That map is an indication really of where our current staff are based. But each one of those staff, some of them are prepared to work 20 miles away from where they live. So depending where the client is and where the staff capacity allows, we will go anywhere in the county.
Brilliant, brilliant.
Thank you. You mentioned at the beginning of your presentation about long-term clients, and you've seen an increase in those that unfortunately have passed away. And I just wondered, do you know, is COVID related, or are there other factors linked to health and well-being and isolation potentially linked to that?
Not COVID. We've only had one client who was who they thought might have it, and he was presenting with some of the symptoms, turned out not to have COVID-19. So we've been fortunate in that respect. But I think that just like during the summer when there's a heat wave, or in the winter when it's particularly cold, where the physical environment changes, I think when the social and economic environment changes dramatically, you're going to see an impact on people's life chances. And that is certainly been evidenced, I believe, in terms of some of our longer term clients. Where they were coping and keeping going before, I think a lot of people have lost a little bit of hope and thought, what's the point of hanging on? Because, you know, life isn't what it used to be. And I think that's an issue that has to be addressed and has to be dealt with face on.
Yeah, thank you very much. Just another question really. You mentioned workforce, and interesting to hear in a kind of gig economy the different types of people that you're attracting to the care sector, particularly around the number of vacancies that are on a continued challenge for the care sector. And I just wondered, given the flexible working and the attracting people to the service, how do you see that being maintained, given that it's still a growing need in Cornwall with an ageing population? So how do you think as a sector we can continue to attract people to what is a really rewarding profession and sometimes somewhat misunderstood?
Okay, you asked a big question there, Nicola, massive question really. But look, from our point of view, our perspective on flexible contracts is this. Out of 40 odd staff, we offered a contract, an hourly contract to every one of them, and only one said they wanted it. That one then started to go on the sick on a regular basis. So it was kind of, for us, it was an opportunity we give staff, but they didn't want it, because a lot of the people that we employ, and we employ quality people, we really do, they were ex-case coordinators, ex-midwives, ex-social workers. Some of them are students. Some of them are like the fact that they can dip in and dip out according to their life balance. Not everybody wants to work 9 to 5. You know, the years where I went down the pit at 7 o'clock in the morning, could guarantee coming up at 3:15 in the afternoon, have gone. For a lot of people, they want flexibility. So we give that opportunity. Where people want a contract, if they prove that they are consistent and determined enough to have a career in this, we will give them a contract, because the demand is there. So it's kind of, I think people are misunderstanding this 0-hour contract thing. It has such a bad name, but often a lot of people want it more than don't.
Yeah, thank you. Tracey's also just put a note up to say that they're working with Exeter University on inclusivity aimed at small to medium enterprises and supporting them to recruit staff with disabilities, long-term conditions and marginalised from the workforce. Would you be willing to be interviewed about your experience?
Yes, certainly. We've had more than one member of staff with disabilities or health challenges who work for us as employees.
Fantastic. So I'll let you guys connect over that. Thank you for such a fantastic presentation and really interesting points that you've raised that I'm sure we can all kind of take away and think about how we can better kind of work together. And it all points, doesn't it, to something that actually Tracey also raised about local support groups, information coming together through multidisciplinary teams. And I guess all of these points just really highlight how important it is that we continue to develop that approach. So thank you very much, Reuben, much appreciated.
You're welcome.
And over to Kevin Feaviour from Ibelong.
Reuben, you might want to stop sharing your screen.
Yeah.
Thank you.
No, I should be able to share mine. He says. Can you see that?
No, we can see you.
Oh.
Not to worry. You might be able to read it, Kevin. And
what I have done is I've sent it to Nikki. So Nikki, I don't know whether you can see it, but I can read it. Why is it not sharing? That's odd.
It's not come through to me yet, Kev.
Ah, okay.
So if you don't mind reading from it, Kevin, we can maybe we'll be asking participants anything to share. We can send it out after the meeting. Is that all right? Because I'm aware that we're running late.
Bit time. Okay. Well, thank you. And again, I mean, I agree completely with what Reuben was saying, that, you know, there's this vast amount of activity and support that's going on that people know bits of, and I think people see some of it, but that sense of the whole and the kind of bringing this together and integrating and thinking like this kind of network of support it's absolutely amazing to see it. And this bit is crucial. It is really important that what's going on today. And the Ibelong and Community Connect is a very new thing in comparison to some of the things that are going on. So I mean, what I'm going to do is just talk a little bit about what we are doing. And effectively, Ibelong is a response to well-being and mental health issues, where much of the work that we've done in the past has been focused on people who, with those issues, who have felt more and more isolated and lonely, and as a result of that, their physical and mental health deteriorates, which increases the isolation and loneliness. And you will know that. So one of the things we did in working with a lot of people who've experienced this is they said, we just want to belong. So Ibelong is literally a program which is looking at ways in which we can connect people by supporting community networks, by looking at the people that are in and around everybody's lives, and giving them opportunities just to, through training, through development, through coaching, just to up their skills and understanding about how we can perhaps better respond to some of the issues that we're noticing, and how we can have conversations or relationships with people that offers support, but doesn't mean, this is not about cure or making people better, but it is about helping people focus and move forward. So the kind of conversation tools and techniques that we work on are things based around restorative practice or systems thinking, which is enabling people just to think beyond where they're at into what are they thinking, feeling, what do they need, and how do they move that forward. So it's a response to a lot of people saying there's no route to the kind of psychological help that people need, particularly with the reduction and the kind of number of people going through GP surgeries or A&E, and actually recognising that from all the research, and part of my research in the background in the past has been that help-seeking behaviour will tend toward those people that people know best. So that will be friends or family or significant others in a community. And in a sense, most people will turn there before ever seeking professional help or some of the kind of more professional routes. And it's like, how can we make best use of that support that's there and ensure that the kind of responses and conversations that they have from those friends, family, or significant others can really enable someone to feel heard, to feel understood, and help move on with some of that, rather than people being scared of it or opening, think they're going to open a can of worms and I can't do it. So it's about building confidence, it's about developing skills, it's about building understanding about what we can do in terms of our responses and how we support people. So there are and we are, the whole idea of this is it's based around local community. So this Ibelong is not a new service. It's not a new project. It's built working with projects and services that are already there and building capacity to support them. And where we've had funding from health services or other groups like that, what we've always done is said we've put money into the local organisations alongside it, in a way that when I used to work in education, teachers who went out on training, there was always backfill for the classroom to ensure that the children had someone in the classroom with them. So in the same way, within the voluntary sector, often there's a pressure on those services. So it's something about how we can support them by providing funding whilst doing training, but you build the capacity of that organisation. And just to give some examples, I mean, we've worked with rugby clubs, we've worked with hospice care, we've worked with shops, greengrocers, opticians, we've worked with parent support groups, a whole range of people that have arts groups that have come together and shared training, shared learning, shared understanding, and then co-created their own responses. So using the networks and the relationships that they've already got, build those into the program. So Ibelong is bringing people together, developing learning and skills, looking at ways in which people can collaborate and network to take things forward for the future. And my background is psychology, counselling stuff. This program is about not counselling, and it's not about psychotherapy. It's about conversations. It's about something that everybody can do. So there is something about well-being being an everyday thing. It's not something you get referred to. It's something that happens around us that can be supported. It can be conversations while you walk by the sea, conversations on a train, on a bus, wherever it might be. It can, in a pub, it can happen around us. So it's through community activity. It does link to economic well-being. So I absolutely believe that some of the organisations that we've involved with are businesses and certainly some of the kind of cafes and that have recognised that where they've been seen as a well-being space for people to talk, then actually they've become seen as a friendly cafe, which increases footfall, etc. So it does support community activity and stuff in that as well. I'm going to race through this bit, but there's a number of projects we're involved in Cornwall, but also across Newham. We're working with psychological support for people with serious youth violence and knife crime. We've got a Reflect project, which is an EU project supporting social and emotional learning for young people, and also across East Devon we're working with 5 towns to make them wellbeing friendly. But in Cornwall specifically, I mean, it is really exciting. The work that's happening now is based around social prescribing. There's conversations about community-based pain management. We've recently got some money to do some work around innovative approaches to suicide prevention, dementia-friendly communities in Truro and St Agnes. And then in schools, we've been working with Chasewater and about to start with Devoran School, working with year 6s specifically to support them to think about well-being, how they can support their own but support their others, and think about that transition into secondary education to make that whole process a bit easier as well. So there's a number of projects that we're working on, and we're really keen that it's accessible and that it isn't like you come to something and say, right, I've come to talk about well-being, but rather that there are other ways in which you have conversations. So we've created, when you see the slides, you can't see them all now, but we've created menus, we've created recipe cards, we've got a well-being app that we're using. One of the things we did around loss and grief is actually work around games. So a group of people actually designed their own loss and grief snakes and ladders. And it was amazing, just by having that kind of design activity, then they started talking so much more about their own life. So, you know, a ladder was maybe, you know, finding someone you could talk to. A snake was someone who's crossed the road in front of you, who you knew, but didn't necessarily want to have a conversation. So it was just really important way of kind of engaging and supporting people with that. And we've even had one group create a game called Emotionos, which is like dominoes, but based around emotion. So it's using those kind of fun, creative ways of looking at things as well. And I do have a film here, which we've started making on well-being conversations. But again, I'm not sure that you can, I really don't know whether you can see it. But we're creating short films on how to have a well-being conversation, not for professionals, but just things that you might be able to put through a doctor's surgery or any opportunity where you can show something. Which just helps me when you're listening. Make sure that you're listening and you're hearing for the other person. You're not just listening for yourself. You're not just having that conversation. So we're looking at creative ways of building on some of those things. I'm very aware of time, so I might just hold out there as you can't see any more slides. You haven't got the slides yet, Nick, I guess. No,
nothing's come through. I've been checking.
And also, Kevin, we can share the film if you send us the link to the film.
Okay, I'll do that.
PowerPoint, we can certainly share that at the end.
I would say the film's in development at the moment, so it's not quite finished, but because we've had to green screen, but we've got a lot just to add to it. But you get a sense of we're just trying to make it stuff that people can see, and it's not in books, it's on cards, it's on film, etc.
Right. Thank you.
Stop.
Great, thank you, Kevin. And just obviously Rebecca has just asked whether we can send a link for the film. We'll definitely send the presentation, and when the film is ready, make sure that that is circulated to everybody. So if there's no further questions for Kevin, we'll go on to Helen.
Hi, thank you. What I'm going to do is do the presentation, and then I'll email or get Lolly to email everybody out because I know where my computer skills end. So I'm Helen. I work at Cornwall Hospice Care as a therapy and community manager and also lymphedema CNS. So I'm very fortunate to work alongside Lolly on a daily basis with Claire and Tracey. So I'm going to kind of just do a little bit of a background on what our community services was about. So in the world of palliative care, it's always evolving, and we're kind of constantly adapting to meet the needs of our future patients. Many of them are being kind of determined to be cared for at the home. So the charity's vision is for people living with terminal illness in Cornwall to be able to access the care and support that they need at a time and a place that is right for them. And because kind of Cornwall Hospice Care is about palliative care and bringing everyone together, this is kind of where our community comes into play. We're constantly trying to work with the ethos of the Cornwall community services, which is about care, it's about valuing people, listening, communicating, collaborative, which is about today as well, which is great to hear so many guest speakers turning up, and it's about innovative care. And with COVID, we have kind of completely had to think out of the box, as is most other organisations. So our services, they're all held free of charge, and they're for patients and carers suffering with a palliative, terminal or advanced progressive condition. And the aim is basically for everybody living with the above criteria to be able to access the care when they need, but it's also looking after our carers and the families, because quite often they are forgotten. It's about offering them supportments and treatments in a comfortable setting. And we're constantly evolving. When we set up the community services some years ago now, we kind of worked out what didn't work, what has worked, and we're kind of sending out questionnaires to our patients and the families just to kind of see where they need us. So we're constantly evolving and listening to what our patients and carers are kind of saying to us. I'm just going to the next slide because I've just whizzed on. So pre-COVID, we were kind of set up lots of different parts really. So we had a neighbourhood hub, which was mainly therapy based. We had community friendship cafes, wellbeing workshops, bereavement friendship cafe supports, and lots of community engagement, events, fairs, offering lots of information and signposting. So our girls were kind of out and about, and we also work really closely with our volunteers at Cornwall Hospice Care. They're a huge part of what we do, and we have our own community services volunteer network as well. So our community friendship cafes, they were holding multiple locations, and we were just about to launch new venues, new locations until COVID changed things. So we're currently at the moment in Perranporth, Newquay, Falmouth, Camborne, St Ives and St Just. And future locations were in Truro, Tintagel, Bude, Bodmin and the Rane Peninsula. The Rane Peninsula was going to be much more therapy led, so that you'd have physios, OTs and the complementary therapists in there. I'm whizzing through because I'm very aware of the time, Nikki. In our neighbourhood hubs, basically the criteria is to have a palliative terminal diagnosis and aged 18 and over. And at the moment they're kind of run in Penzance, Weybridge and at the 2 hospices. And the main services that we're offering were physiotherapy, which was to maintain physical independence, occupational therapy, and that's kind of where they come into their own. So they're kind of bringing up the patients, which they're doing a lot more now than doing home visits, and just to see what's needed by the patients. It's about maximising their functional ability to maintain and improve their independence for as long as possible. And part of what the OT does for our patients is a lot of anxiety management now and fatigue management. So they're kind of developing that service even more and more. And we also offer a complementary therapy service as well. The community friendship cafes, they were kind of done in a joint initiative basically with other community places as well, through GP surgeries, church partnerships and crews, and they're a bit more of a drop-in session, so conversations, support, T&K, a quiet place, some wellbeing activities, and we also do a bereavement support as well. And on the presentation, it's actually got a couple of the posters, so Lolly will share those afterwards. The wellbeing clinics were run by the complementary therapists and our therapy assistants and a lot of our volunteers as well. There were monthly events, and we actually had a 12-month programme set up for the whole of this year, which was about soothing the mind, soothing the body and soothing the spirit, which obviously, as with COVID, has happened, and that hasn't kind of developed much more now. But what the girls have done is they've actually gone onto our website and done quite a lot of self-help groups as well, so they've kind of gone through how to do massage, how to teach somebody how to do massage, how to do relaxations. So they're kind of working, they were working very, very well and very, very well attended, which Tracey, who's our coordinator, has kind of got all the figures if anybody wants them. We're also running a bereavement friendship group as well, which is kind of done with Cruise Partnership, and one of our team is actually a Cruise bereavement counsellor as well now. So we're kind of looking at developing that further. And kind of that leads us to where we are now. So obviously it was a community service. Everything was done in the community. You know, we're very hands-on with a lot of our patients, carers. So we've kind of done a virtual cafe now, which is about offering a listening ear. So it's about a 30-minute service. You know, you can have it however time. So Lolly and Claire have been running that, and that's kind of been a very well thought out process, really, and it's been kind of proven very useful for a lot of our patients and for their carers as well. We are doing a lot of telephoning all of our hub patients from the neighbourhood hubs that can't come into us now, just to make sure that people are okay out there. And we're doing a lot of virtual Zooms for our patients from a physio point of view, and just basically a lot of hand holding, which has kind of worked well for all of us. We've all kind of had to choose a different way of how we're working. And again, going back to our website, we're constantly looking at how we can develop things. So we've done advice from the lymphedema therapist, from the physiotherapist, from the wellbeing, and from the occupational therapists. So that's us in a nutshell. I've kind of skimmed through because I'm very aware that there's another speaker and I don't want everyone to kind of have to run over time. But yeah, we've kind of changed things. I'll come back if I can now. We've kind of come back, basically from COVID, it kind of changed everything like it has for everybody else. So we're constantly evolving, looking at how we can develop. We've got a couple of other projects in the pipeline with different organisations, and we're just really seeing what people need out there. And if people need our help, then, you know, we're the first to kind of go, this is what we're doing. We do have all of our databases, so we can kind of contact all of our patients on a regular basis. And that's really where we are. That's me done, Nikki. It's a whistle-stop tour, just so that everyone can kind of, you know, I'm very aware, and my team know that I talk, you know, very, very fast anyway, but I'm just aware of time. So if there's any questions, I'll gladly answer them.
Thank you. I mean, wow, what a tremendous amount of work on the go. And I have to, from a personal point of view, in saying that it's always fantastic to collaborate with you. Yeah. And the opportunity to develop the friendship cafes for loss, grief and beyond, which was a real collaborative approach. And unfortunately we got stalled with COVID, but to take that up to 10 towns and villages initially, fantastic. And really today, and I suppose one of my questions would be, just having heard everything today, and you know, our first kind of day of our community seminar, what are your thoughts about the opportunities as we're moving out of that kind of, if we ever are in a post-COVID situation, generally, I guess both virtually for some of your services and collaboration, but also how we can also to kind of pick up more on Tracey's point about how do we do more in localities collaboratively.
Absolutely. I think us as a team, we're kind of always looking to work with other people. I think on hospice care, you know, people need to know what we're about. So the more that we can work with other people, absolutely fantastic. We've got our Facebook, you know, for the Cornwall services that I know we've worked in conjunction with lots of different organisations. So we're already starting to do a lot of collaborative work. And I think the more you can work with people, just the greater network you can get to. And at the end of the day, it's about reaching our patients and carers. So yeah, the more that we can do that, I think it's valuable. Yeah.
Just one more thing, really, I guess, and that sometimes we're all under funding pressure. And one of the things I think that's been great in terms of lots of the organisations that have been on the call today, but obviously particularly thinking about Cornwall Hospice Care as our host today as well, is it's not always about the money in needing to get things off the ground or pilot things. So it's actually about how can we utilise resource that already is existing, and perhaps just, you know, take a bit of a deep breath and a little bit of leap of faith and try something that could then follow. Funding can follow a proof of concept, and I just wondered your thoughts on that.
Yeah, I mean, we've got a couple of projects on the go at the moment that we're kind of waiting for funding, but if it doesn't come through, then we're kind of already looking at how we can utilise it and work with other people so that these events can kind of still be established, you know, because, you know, Cornwall Hospice Care and the community services believe so strongly in collaborative working and how we can get to our patients and carers. So for us, yeah, we are, and the executive team are always kind of there to support us as well, to kind of make that leap of faith as well, because they see the wider picture, they see how important it is to work with other people as well. So yes, and like Lolly and Claire and Tracey always coming up with new innovative ideas. Just to kind of, yeah, I can hear you chuckling there, Lolly. Just to kind of keep everybody, you know, the process going. So yeah, absolutely, we're very much part of, you know, joining with other people to see what they can bring and what we can bring to them as well.
Great.
Yeah.
Thank you so much, Helen.
No
I
problem.
really appreciate it.
Thank you.
And we'll, as Helen said, we'll circulate the presentation.
Yeah.
And now over to Rene. You're on mute, Rene.
You there, Rene?
Great. Is that better?
Yeah.
Can you hear me? Great. Okay. I'd put myself on screen but not mute. I'm just seeing if I can share my screen. Can everyone see that? Is that working?
Yeah, that's fab.
Fab. Okay, lovely. So I'm going to cover two slightly overlapping projects today. Overall, the carers service and then the veteran outreach service that I work for are both covered by Cornwall Rural Community Charity, CRCC. But particularly we're looking at the carers service today, and as I said, the VOS, which is kind of new and in the process of being launched. So that has been a very interesting process in the midst of COVID. But first of all, Kernow Carers Service, little activity impact report, April to June 2020. Prior to COVID, our team, which numbers about 15 or 16 carer support workers across Cornwall, visit carers generally at home, sometimes calls, but a lot of home visiting out in the community to do carers assessments, which can both initiate a small fund for a carer for the year, but also linked to lots and lots of other signposting, links to other organisation, links to other sort of internal referrals within our own charity, but also provides a real support network for unpaid carers across Cornwall. We are data-based, so we link directly to the Family Information Service, to Adult Social Care and Cornwall Council, and do carers assessments on behalf of the council. So some of our aims are to enable carers to access the appropriate support, especially in challenging times of this global health pandemic. All of our team actually stayed on, no one was furloughed, but we had a big shift from a lot of face-to-face work to lots of online Zooming and phone work to carry out these carers assessments, which has had its challenges. Primarily, we wanted to prevent the isolation of people who have a caring role, because obviously COVID-19 made things extremely, isolation that was there already, even more exacerbated. So lots of cases where a carer was separated from their spouse or adult son or daughter because of either a hospital stay, or following a hospital stay, then having a placement in a care home or residential home, possibly at the other side of the county. And obviously, because of the extra stresses and strains of COVID, there were some communication breakdowns, or certainly delays in communication of getting regular wellbeing reports. So there was a little bit of liaising and support along those lines. In a number of cases, sadly, support for carers who had actually been bereaved and hadn't been able to be with their loved one at the time. So it's had a lot of emotional impact, and we've tried to support both directly and then signpost to other support organisations such as Crews and other support services following that. One major thing we try and do is prevent or delay crises and or carer breakdown. So where a carer is finding their caring role increasingly difficult and they're approaching a potential state of breakdown or burnout, breakdown or some level of burnout, we try to intervene and make referrals as necessary, put in place support systems, and sometimes just letting them know that we're there at the end of the phone can really, really help as that fallback. As I mentioned, we support the local authority to provide carer support resources for carers and try and provide all the information needed, the advice, guidance and appropriate signposting so that carers can feel as informed as possible. And what was wonderful at the beginning of COVID is all these tiny community groups and larger charity groups all coming together, brilliant databases being created at really, really small levels, sometimes tiny hamlets or areas that local, very, very nearby support was available to each carer. So it was great to be able to access that. And I think Tracey mentioned at the beginning the fact that there was a sort of some breakdown of barriers between organisations and people really, really coming together, and the informality as well of working with other groups and other charities, pulling together in the midst of a crisis to create the best possible support for service users and clients. A lot of our work involves trying to allay fears and anxieties, and to really try and facilitate carers to maintain their caring role in whichever way possible. To identify and make available additional resources to vulnerable and priority carers, looking at safety support activities, and to improve physical and emotional and mental well-being. So there's some of our sort of aims and objectives. And one thing which I'll cover now in highlights is that as well as looking for national grants and well-being for carers and access to money, we had access to an in-house well-being grant, so the COVID-19 well-being grant. That was a real highlight, and it meant that we could reach new carers and look at some of the most vulnerable carers on our database that would have maybe very, very limited access to getting themselves an item or a service. And our aim with the grant was to very quickly and efficiently find out what a carer would like to enable them to stay well at home or within the midst of shielding. So it could be anything from a yoga mat to a subscription to a viewing service to an exercise bike to some garden furniture, anything that we could reasonably argue would actually help them stay well at home. We spent a lot of time contacting some of the most vulnerable carers and some of the most isolated families and providing them with signposting information. That's really made a difference to carers who sometimes feel forgotten. One carer, and in fact I know several carers have commented along these lines, that they so appreciate that someone outside the family cares about their mental well-being. Lots have said it's almost, left them in tears that someone out there was thinking about them and trying to lighten the load in some way during this extra level of stress the last few months. We've run forums for years, but we're actually trying to run online forums now, which ensures that carers continue to have a voice during the pandemic. It's given us an opportunity to reach a whole new audience who might be unable to join the forum physically. And this is a model that we're planning to develop. We've got a really good IT department at CRCC that do a lot of outreach work. And one thing we're trying to do is get sort of wellbeing groups and social groups up and running online with assistance by telephone and online to help people who have more limited access to broadband or to computer skills, etc., to still be able to maintain social contact and a sense of well-being and reduce social isolation. So that's something we're working on hard at the moment. And as I said, unable to carry out home visits due to the lockdown, but the importance of seeing faces became very marked. As I just suggested, we're developing a virtual visit pilot, and assessments then possibly can be carried out by video call. But as well as assessments, those who are shielding or having to be isolated for whatever reason will be able to join maybe some sort of social or community group. So both assessments and social isolation could be tackled with these online services and virtual visits. Outcomes are 1,391 carers contacted by email, letter or phone, and this included information, guidance, signposting, support, offers of a grant. 456 carers assessments were provided during this time, alongside extra support offered to the local authority access team, which we supported and were a fallback, and that resulted in reduced impact on statutory services, which were overloaded due to the crisis. 122 carers accessed items to support their wellbeing during lockdown through the KCS Wellbeing Fund, and about £11,500 so far has been received by carers to support wellbeing. It was a very simple, quick conversation over the phone to access the grant, and then we would go ahead and our admin team would order the items and have them delivered to their door. So it made it really, really fuss-free for the clients and the carers. And so far, we've held 3 virtual forums covering East, Mid and West Cornwall, giving carers the opportunity to have their voices heard as part of a bigger picture and potentially lobbying carers' rights, etc., etc. These are some of the lovely comments we've had. We thought it'd be nice to share some comments from people who'd received a wellbeing grant over the last 2 to 3 months. Someone has said, it makes me sit down, switch off and relax, and also learn about gardening, which is a new hobby. Someone who received a Kindle said it's been amazing, really good books, and it's made me take stock and sit down and read. It's helped me to feel much more relaxed and chilled. Someone else has said the yoga mat helps me do daily yoga practice, which is good for my body and mind and helps me manage stress. So every single person that got a grant, we got back in touch with 3 or 4 weeks later to see how they were, not just in terms of what they've received, but how they were in general in terms of their well-being. If I can switch now to another screen, if I'm okay for time. This is, oh, hang on, I've come off now. Where are we? Okay. So this is our brand new service. We were the Aged Veterans Support Service before, which again supports veterans, and originally it was veterans born before 1950 and their families. We're now the Veteran Outreach Support Service. We will be doing a big launch, so I'll include everyone today in the sort of launch documents and leaflets and everything else in the next, sometime probably in the next 2 to 3 weeks. But it's for any veteran over the age of 18 and their families, carers, etc. This obviously has been launched within the limitations of COVID. So again, we've been working basically over the phone or via Zoom and working remotely as wherever possible, and also trying to look at setting up support groups for veterans in the virtual realm. So are you caring for a veteran or a veteran looking after someone, we can help you get the advice and information that you need. We offer support to veterans and the family members and carers of veterans, or perhaps a veteran who themselves has a caring role. We're helping people get online and helping with virtual skills. Ultimate aim of improving the well-being of our clients, helping people sort their finances, getting a carers assessment, much like the carers support service offers, and finding support and social activities to combat social isolation. We work one-to-one, we facilitate group events, and we provide lots of information to try and help people as well. Just some of the examples, we offer a holistic approach and support for those in a caring role or being cared for. We give lots of support and form filling with entitlements and benefits such as attendance allowance, PIP, etc. We help out with blue badges, carers emergency cards and lifelines. And of course, all of this is done over the phone and facilitating things online. Carers assessments and potential access to personal budgets. Emotional support and with the support with reducing isolation. And this has been a really big factor during COVID. Linking in with the local community and support groups. Signposting to relevant organisations. And as I mentioned, here's our contact details. So our email and telephone number, and I'll make this available to Lolly as well via email. So veteran outreach support for anyone over 18 who has completed just 1 day of service with any of the armed forces or who completed national service. And the support is also extended to their families and carers. It might be that we encounter a veteran who doesn't necessarily have a support need, but their wife or daughter or carer does, okay? So that's our telephone number and email. And as I said, we don't really have a comparison prior to COVID because this has been launched within COVID. So it's been a really interesting time to try and launch a service. And we'll be doing a lot more promotion over the coming weeks. Okay, that's probably it for me. So I'll just open to questions, okay?
Thank you so much for that. What a phenomenal, God, I mean, honestly, today is quite mind-blowing in terms of the amount of work underway. There's a question really in terms of we're talking about the Zoom and the online, and I just wondered, how have some of your beneficiaries found, and how have your team worked with challenges of people in their own home, given that they have, got so many things going on in the background? Perhaps they want to have difficult conversations or conversations about another family member. And I know, speaking to domestic violence charities, that's been quite a challenge. So I just kind of wondered from your perspective how that's been.
Absolutely. This is under discussion actually at the moment. As a team, we've met. We're quite close as a team actually. So there might be 20 of us, including line management and admin, etc., all talking on a Zoom meeting. And we've had chance to go through what's been going on for us. A fantastic mental health lead, Darren Chaplin, in the organisation, who's been developing some sort of well-being and resilience resources for us. And we've been talking the option of getting together twice a week for half an hour to pull resources, talk about how things are, etc. There are differing responses to opening it up to working from Zoom. There are some team members that feel comfortable about that. There are some team members that don't feel so comfortable. Those that perhaps feel Zoom is quite an invasion of their privacy, or that maybe have young children, or lots of stuff going on. So it might be that, and I'm sure that's echoed in client groups as well. Some people would love something face to face. Some people are actually very happy to talk on the phone, and they'll say, well, this is lovely, I didn't have to tidy up before you came. So actually, I think there'll be different preferences, and hopefully it will marry up, that perhaps we can work out that people who would like to have a carer's assessment via Zoom could be paired up with a carer support worker who's happy to do things via Zoom. So I think there are probably lots of ways that this might evolve. It's a work in progress actually, and of course there's loads of elements of privacy involved. It could be as well that for those that feel Zoom from home is invasive or a bit too sort of encroaching on privacy, can work quite safely from a social distance office space, so that they can Zoom from an office space which feels more neutral and a bit more secure. So there's lots of discussion underway about how that will work out, that will involve everyone feeling as safe and comfortable as possible.
Great. You mentioned resilience, and I just wondered, as we're going into autumn and winter, how you kind of saw the resilience of the clients that you're working with, and perhaps on a local level, what collaboration is going to look like to better support those individuals.
Right, okay, well, for a start, I don't think sometimes resilience is seen as just endlessly bouncing back and not getting upset by anything. And of course, it's not that. It's about having a toolbox of strategies that try and keep you as well as possible in the circumstances. So in terms of us, we're trying to avoid those carer burnout or carer breakdown in extreme cases. And I think a huge part of that is people feeling listened to and feeling heard. Some people have been so moved by receiving a small item, not because they've got a tablet or a yoga mat, but because someone thought, oh, I'll ring this carer and see how they are. The fact that they know that there's a wider network out there of people who are, that do have their interests at heart. And I think ongoing, it's about every organisation helping people with their self-care and helping people find ways that to keep themselves, compassion for themselves, self-care. And well-being, doing what we can within more limited circumstances to maintain well-being as much as possible. So as I said, we're working on trying to do some virtual Zoom groups for client groups where they're primarily in their 80s and 90s and would meet once a week for a game of bowls or lunch or an activity, trying to help them, where some of the most socially isolated groups just come together and have a voice at the end of the phone, and reassuring them that if they need to phone and ask for some support or guidance, signposting, information, that they can, and they're very welcome to make contact. I think that's the key thing, making people know that they are very welcome to make contact and ask for support, and that they will do our best to provide it.
Just kind of one final question from me before we close this session. Obviously, there were lots of changes to the way that needs assessments were being done during COVID, and we kind of went to one form going into wealth and health and wellbeing hubs, And I guess just in terms of your referral process, you just talked about, you know, how people have been working with challenges, if people have been placed in other parts of the county, etc. Have you seen the changes in how needs assessment and referrals are working as a positive thing that we can grow and continue, or do you think we need to take a breath, do the learning and see kind of how we regroup going forward?
I almost don't feel qualified to answer that question. I would rather you direct that at the team lead or someone like Jane Price, who oversees all of the carers service.
Okay.
I from my own perspective, just as one member of the team, I think there've been some changes which are really positive and some things which still need looking at. So sorry to be vague, but I think you get a far better response, a more helpful response, by talking to someone who's in a bit more of a senior position in terms of the administration of all of this.
All right, thank you very much. And
okay.
that we can pick up. No, it's great, because some of the questions we'll just circulate after anyway, and we can then share some kind of more detailed responses. So thank you so much for a fantastic presentation.
Okay, thank you.
So we're coming to the end of our first day, and we've survived, which is fantastic in terms of our IT. Honestly, on a personal note, very blown away by the amazing work underway out there, and I think it's presented initially again some quite interesting points. Some of those just kind of to highlight really the COVID period almost being seen like a winter period in terms of increased death due to social issues, increases in safeguarding and referrals, obviously setting up new services like the Veterans Support Service, the work that Age UK and Fiona talked about with Re-engage, and how we can actually continue to work on a local level to really develop local networks and taking multidisciplinary processes forward. How we don't always need to we do have to think about money, but we don't always have to think about money in terms of getting initial collaboration off the ground. Today is a prime example, and the use of virtual technology, but actually how do we start to really think about how we can support wider engagement with digital technology if this is here to stay, and organisations across the board talking about developing online services. So I think that raises a key issue that we've already talked about, being able to take up to a national level. So I think lots of great points raised today, lots of amazing contributions, a very diverse audience. So thank you so much, and we will share all of the information, and if there is any other follow-up questions or information people feel we've missed, it would be great to have, or just general feedback about the day through our survey. We'd really appreciate it. Lolly, I don't know if there's anything you'd like to say.
No, I'm going to paste the survey now into the chat box, and hopefully people will feel inclined to give us some feedback, which would be amazing, because obviously we move forward as we go on. That should be in there now. So if people don't mind having, I don't know why it's come up so queer. Yeah, if people can do that over the next week or so, that would be amazing, because we'd like to do more of these in different shapes and forms. So thank you everybody for taking the time out in this busy period that we find ourselves in, to take the time to do it. So great.
Thank you.
And hopefully some of you, or all of you, will come tomorrow for the next phase.
Thanks.
Thank you. Thank you,
Sally Turner, just to say thank you. I tried to write something in the chat box, but I don't think it came up, but I've learnt a lot and it's been a very worthwhile session. So thank you very much indeed. Excellent.
Thank you, Sally.
That's really appreciated. Okay, see you all later. Have a really lovely evening. Hopefully we get some sunshine. We can all get out from behind Zoom and out for a walk and some fresh air. So thanks very much. Bye-bye.
Thank you.
Thank you. Bye.